When I first explain PRP to patients, I say it's like this: your body is already packed with natural healing power. We're just concentrating that power and directing it exactly where your body needs it most. Essentially, we take a small amount of your blood, spin it down to concentrate the platelets and growth factors, and then place highly enriched plasma at the surgical site to accelerate bone and soft tissue healing. So, this is the question that I get asked most about PRP: how much faster will I heal? The answer is nuanced, but here's what the data shows. While PRP doesn't make your implants heal twice as fast, it significantly accelerates the initial stages of bone regeneration and soft tissue integration. This means a stronger foundation right when you need it the most. When I use PRP in an implant case, here's exactly what changes about the procedure. From a chair-side perspective, it requires meticulous timing as we draw your blood and process it right before surgery. But down inside the surgical site, it actually simplifies the healing mechanics beautifully. The concentrated platelet gel forms a bioactive matrix that optimizes clot stability and keeps the bone grafting materials exactly where I want them, drastically enhancing the surgical precision and predictability. If I'm working with someone whose jawbone isn't ideal, PRP becomes less of a nice to have and more of a should have. Here's why. In softer bone, or in cases with a history of advanced gum disease, the natural cellular signal for healing can be delayed. By placing concentrated growth factors directly into the implant site, we actively jumpstart cellular recruitment. It floods the area with a specific protein needed to dense up the bone matrix, tipping the scales heavily in the favor of strong, successful integration. One of my patients asked me, can I play golf the next week if I have PRP? The answer has to do with inflammation and how fast we can reduce it. The rapid flood of your body's natural growth factors help regulate the early stages of swelling. By compressing that initial inflammatory phase, we noticeably reduce postoperative soreness. This means a lot to our active retirees on Marco Island because they can get off the couch, minimize the downtime, and get back to the pickleball courts or fishing boats much sooner and much more comfortably. A lot of patients ask, is PRP worth it, or is it just an upsell? Here's how I think about it from a clinical standpoint. As an advanced credentialed dentist, my ultimate goal is ensuring the absolute lifetime longevity of your dental implant. Investing in PRP means we are utilizing premium autologous biotechnology to minimize surgical risk and maximize early bone density. When it comes to securing long-term success of your smile, using your body's own optimal healing power is always a profoundly smart investment. When we talk about implant success, we're really talking about three things: bone integration, soft tissue integration, and stability. PRP doesn't just affect one of these, it enhances them all simultaneously. Soft tissue acts as a vital protective seal around your new implant to keep harmful bacteria out. The growth factors in PRP strongly stimulate epithelial and connective tissue healing, giving you a dense, tight, and incredibly healthy gum seal that safeguards the underlying bone structure for years to come. I've had anxious patients come in, learn about PRP, and suddenly feel like we're partnering together to ensure the best possible outcome. Here's what changes in their mindset. Dental anxiety often stems from a fear of unknown healing timelines or potential playing. When they realize we are harnessing a completely natural, ultra-safe component of their own body to actively prevent complications and suppress inflammation, the anxiety melts away. It gives them a profound sense of control and confidence over their entire recovery journey.